In this video, I'm going to demonstrate dry needling to the plantar region of the foot, or the bottom of the foot. This is really useful for conditions such as plantar fasciitis or generalised foot pain or plantar heel pain as well. Essentially, we are needling the soft tissue of the bottom of the foot, but we're aiming towards the plantar fascia as well. Now, in the conditions such as plantar fasciitis, the plantar fascia at the bottom of the foot can become irritated, aggravated, and sometimes inflamed. Sometimes we might get micro tears where the plantar fascia attaches to the calcaneus bone at the bottom of the foot. The plantar fascia itself, which is a ligament, is thinner as it attaches to the calcaneus or the heel bone, and then it gets broader as it goes through the base of the foot, and then it branches off as it crosses each of these toe joints, as it crosses into the phalanges from the tarsals or the metatarsals here. So it starts off thinner, it gets broader in the centre of the foot, and then it fans out towards each of those toes. Okay, so that's going to give us an idea as to where we're going to place our needles on the bottom of the foot. So the first needle that I'm going to place is going to be around that common trigger point area at the bottom of the foot for plantar fasciitis, which is essentially here on the base of the foot. So we know through careful palpation we can pinpoint the primary source of discomfort for our client, but with most clients it's around the base of that calcaneus. Our next needle is then going to come in to the middle of the foot, and our final needle is going to come just before these toe joints, or just crossing these toe joints here, but we're going to aim for the middle one. Sometimes our clients might be quite sensitive, so 1 or 3 needles might be enough. On that very first treatment, you might just find that 1 needle to the calcaneus region, or that trigger point area, is enough to help to reduce the sensation that the client is experiencing. After that, we can then build up to our 3 needle technique, and then over time what we might do as our client gets used to the sensation of needling to the base of the foot, we might then put a needle on each of these toes as well, and we can also come into the arch of the foot. So in this video I'm going to demonstrate our 3 needling technique and also placing one of the needles into the arch of the foot as well. With really quick needling technique, the client will feel a release in the base of the foot when they stand up after the treatment. Okay, so the needles that I'm using are the 13mm Classic Plus needles. These are quite thin needles as well, they're quite short, so that we can get into the foot easily, and they're also quite fine, so they're 0.20 in their width. Okay, so we're going to open up the needles, and first one is going to come into the base of the calcaneus. So from here I'm going to hold the client's foot nice and firmly, because we don't want them jumping as the needle goes in. Most of the time the sensation is just a little sharp scratch, and then that eases off very quickly. So Katie didn't really feel that as that went in. It's a small thin needle coming into that calcaneus area. Our next needle, as I mentioned, is going to come into the middle of the foot here, roughly here. Again, we would use, on our clients, we would use our palpation to identify where the best location for that needle is around the centre of the foot. So again, I'm holding Katie's foot quite firmly here, placing that needle into the centre and pressing down roughly halfway. And then that final needle, the plantar fascia area, is then coming just before those toes in alignment. So we can see here we've got 3 needles in alignment. The trick with this technique is making sure that you pierce through that skin quite quickly, because we've got more sensation when the needle is in the layers of the skin, and then once we pierce through the skin, that sensation will die down. Then the final needle is going to come into the top of the arch of the foot. So again, holding this foot quite firmly, feeling for the arch and feeling for the top of the arch here, and then that needle is going just below the top of the arch of the foot. With some of our clients, placing those needles in will be enough for that first treatment, and then on second treatment then we might want to go into those activation techniques. So our activation techniques for the base of the foot, again holding the foot as you activate. We're going to flick the needles first. Then from there, if the client doesn't feel any sensation, then we can turn the needles. And again, if from here, then we can go into a heavier activation technique. So our flicking and our turning are lighter activation techniques, and then our firmer activation technique for the base of the foot would be the peppering. So we're lifting up to the tip of the needle, then pressing down again about halfway, lifting up, and then moving down again about halfway. So we're going to do that about 3 to 4 times. Just again, so we're stimulating that relaxation response in the tissue and also stimulating blood flow and an inflammatory response too, which will aid healing. So that's our dry needling technique to the plantar fascia, or the plantar region of the bottom of the foot.